This is Dr. Jun Reyes, your physical therapist. I am so excited to introduce top doctors here in Long Island, New York. We have Dr. Kilfoyle, Roger Kilfoyle, and Dr. Kim Berlin.
Common arthritis that exists in humans. It's caused by a collection of crystals in the joint. In our blood is a special thing called uric acid, and it's there normally. But when the level of uric acid is too high, it crystallizes in typically the coldest places of the body. And that can happen in the toe, very commonly. It can happen in the elbows, it can happen in the hands. But when these crystals start to form, they can cause something, they cause a lot of pain. And they can cause something called tophi. And those tophi, you'll see them. You'll know when you see them.
That's a sudden excruciating pain. It's like you would really know it's...
Well, the symptoms that we see, a lot of patients will tell us in the middle of the night, we don't know why that is, but they'll wake up with the pain in the middle of the night so severe they can't go back to bed. The sheets hurt them on their bed. The joint involved, which is usually the big toe joint, could get red, it could get hot, it could get very swollen. People might think it's infected, but it's basically gouty arthritis from the high uric acid in the body.
Yeah, so gout, ito yung there's pain, ito yung nagde-develop sa big toe, and pwede rin siya sa ankle, sa knee, sa elbow. So it's an increase in uric acid deposited to the articular joint. So what are the causes of gout? What's causes that you can...
So the uric acid being high in the blood is a symptom of either having you're not peeing it out enough, so you're under excreting.
Decrease renal.
Right, decreased excretion. And sometimes that happens with people who are taking water pills like diuretics. Hydrochlorothiazide is one of the more common ones that's associated with it. Or you're overproducing it. There's too much of the enzyme in your body, xanthine oxidase, we don't have to go into the details, but you're making too much uric acid. And when the levels get to a certain level, that's when they start to form inside your joints and cause excruciating pain.
And the risk factors?
Well, the risk factors, it could be obesity. It seems to be men over women, about 5-to-1 ratio, and men seem to get it in their 40s to 60s more than women. Factors that could cause this is dietary problems, food which is high in purines, such as shellfish, red meats, alcohol, especially beer, will bring on an acute attack. And so you do have to be aware of what's bringing it on. Diuretics, we were discussing, which is water pills, will also cause an increase in the uric acid, which again will cause the pain of the gout.
Yeah, this is amazing. We got 3 doctors here talking about gout. So it's a big help for people who are suffering gout. And gout can be could be an overproduction of uric acid too, or it could be medication that you're taking, or patients who had underwent chemotherapy that can also overproduction. And some patients with chronic kidney condition can create hyperuricemia. And the foods that we were taking, it's not uric acid, it's the purines. Can you talk more about the purines, about the food?
So when it comes to purines, like Dr. Berlin was saying, that there's certain foods that contain more purines than others. And so the classic examples are shellfish, legumes, but purines are also not the only causative factor. High fructose corn syrup is probably one of the biggest things that
you can tell the televiewers.
High fructose corn syrup is probably the most important thing to avoid. Studies have shown that just avoidance of high fructose corn syrup, which is a sugar substitute in a lot of soft drinks and other sugary foods, can cause a direct decrease in your serum uric acid. Just a dietary modification can improve a lot of the uric acid.
Shellfish, red meat, liver,
organ meats.
Organ meats, right? And how about food that we can eat Dr. Berlin or Dr. Kilpot?
So there's just a recent study that came out out of Johns Hopkins just last
And
month.
this is a new article you were
Brand
showing.
new,
Yes,
brand new article.
this is. Oh, guys, this is an amazing. Very important to listen to Dr. Kilpot. He was just telling me about this articles, and it's a randomized controlled trial. This is just when did
so
they?
just March of 2021, excuse me. The results came out. I think it's still pre-published.
Oh, awesome.
But when we say, hey, this food is bad and this food is good, there's no randomized controlled trial ever, even though people have been saying this for thousands of years. There's no science that proved that was true until last month.
Wow, listen to this,
deal.
guys. Yeah. So what did they say?
So they used something called a DASH diet, which was pretty much made for people who have high blood pressure. Pretty much it includes a lot of leafy greens and vegetables, lean meat, and avoidance of high fructose corn syrup, sugary foods, and very fatty foods and fatty meats. So that was the diet. The researchers, they actually helped the patient shop online using Amazon, and they went on Amazon and told them, like, this is what you want to get, this is what you want to get, you don't want to get this, and they made them eat that for a month. And then the other arm of the group, they said, just eat whatever you want. And then they switched them, and they found there was a change in their serum uric acid, pretty much proving the point that your diet can affect serum uric acid, which was not exactly proven before.
Yes, I like that, those kind of studies when they perform like research based. So it's well documented that, you know, changing your diet, lifestyle modification, exercise, decreasing your BMI index or your BMI. That just proved that you can minimize the risk of having,
and it is genetics. It is a genetic disease as well, and they used to call it the king's disease because the genetics were inbred from these kings and queens, and they ate foods rich meats,
food,
and they had the money to eat such shellfish and meat.
Right.
Yeah.
When I was just literally a few months ago, when I would tell patients, you know, they'd ask, hey, what food should I avoid? I literally would say to them, I have no scientific evidence to tell you what you should and shouldn't eat. Because back, you know, hundreds of years ago, only the kings could afford to eat the food that we eat all day here in the United States.
But we do see that. We'll have a patient come in and, on an acute attack, and what did you have last night? And they'll say, oh, I had a lot of seafood. I had a lot of shellfish.
Yeah, I had a shrimp cocktail last night.
Yeah, or I had a big steak or liver.
Yeah. Well, you've been practicing for 40 years.
And we see that. We do see that often.
So all the patients that with gout, arthritis, so food. And how about when they get the attack? How about when they have that pain? What should they take? What we're going to be talking about, ang pag-usapan natin ngayon, ang sinasabi nila dito is about the randomized controlled trial, according to Dr. Kilpot, was proven. They did research. It was proven that change of diet, lifestyle modification, knowing what to eat, what kind of food to eat, what are the foods that you need to avoid, yung mga dapat bawasan. That showed that it's really effective. Now we're going to be talking about medical interventions. We got 3 doctors, 2 great doctors. Dr. Kim Berlin, awesome doctor, and Dr. Roger Kilfoyle. Yeah, they're gonna be doing their YouTube channel, so watch out. Talagang they are really good, amazing. Yeah, so medical intervention. So you have a patient, you've been seeing patients with gout. So what would be your treatment? What's your treatment of choice?
The guidelines made by the American College of Rheumatology, and they recommend that the first line medication is an anti-inflammatory one, and a lot of these are available over the counter. Aleve is my go-to because it has a relatively low side effect profile compared to a lot of other NSAIDs. Excuse me, and it's 1 pill every 12 hours. The other classic one, and I know Dr. Berlin loves this one, is indomethacin. This is also a very safe drug comparatively to some other things. If you have good functioning kidneys, this is most important. If you have bad functioning kidneys, you got to be very careful with NSAIDs. Colchicine is an interesting medication. It's actually been found in the pottery in the pyramids of Egypt. It comes from a flower that can be found near the Nile River, and people have been using it for literally thousands of years. Even Benjamin Franklin has been known to use it. The mechanism of action isn't exactly known, but it is very, very specific for gout pain.
Wow. And when do you use it?
So that is, when I prescribe it, I prescribe the naproxen 500 milligrams every 12 hours, right next to the colchicine. You take it at the same time. And that's typically how my first line treatment. If that fails, I will move on to glucocorticoid, cortisone. But the American College of Rheumatology does strongly recommend that intramuscular or injection of cortisone is actually a good first line treatment. So we will do that. However, because the patient is so sensitive, it's going to be tough for them to even look at a needle as it approaches their foot.
Yeah, imagine it's swollen, redness.
Oh, yeah. But it works. It works very fast.
Yeah, well, basically...
We tend to be aggressive with gout because it's so painful, but yeah, we'll offer the injection. Most patients take it because they're in so much pain. The colchicine is next, because it's orally. It could give the patient diarrhea if you give it too often, and that's time to stop taking it. The anti-inflammatories work very well. Naproxen is probably most mild on the stomach. Indocine's a little harsh, so we don't tend to always push that. And then we have the steroids, the Medrol dose pack, which works very well as well. And if that's not working well, and usually you can tell in within 24 hours, then it could be something else going on. There are other diseases that mimic gout, and you've got to be careful of that.
Yeah. And how do you diagnose gout? That's the one that we... how do you diagnose it?
Great question. And as a resident in the hospital, a patient would come in with a red hot swollen foot, and you have to treat them either as if they're gout or cellulitis. So how do you differentiate that? That's the big question. So to differentiate between those two, a little bit of lab work is probably the most important. A little bit of history taking.
Okay.
Things like, do they have any open wounds? Do they have any other recent infections in their body where they could have a septic joint? So I asked them if they had any infections of the eyes, ears, nose, throat, upper GI, lower GI, UTIs. And if they have, that's a little bit of evidence in the bin of, this could be a septic joint. Any fever, chills, things like that, septic joint. If it's gout, nope, I had the big meal, I had Easter dinner last night, and things like that. I was like, okay, it's very, very sensitive.
It's a very quick gout attack, usually, like I said, usually in the middle of the night, and that's the big difference. A patient who has bad osteoarthritis or other problems, it could be a slower onset. This is quick. They'll tell you 2 a.m. they can't go back to bed. That's a big giveaway that it is gout. And the joint, which again is usually in the big toe joint, is red, hot, swollen. To me, we see it so often, it is pretty obvious. But it could be a septic, it could be an infection, it could be other types of arthritic conditions going on. And we see it, it's not just a big toe joint that people have to be aware of. We see it often in the ankle. I've seen it on one toe. I saw it on a finger on a patient last week. Knee, it can be in different places. And x-rays are important for 2 reasons. You can rule out things. You can rule out fractures. You can rule out infections. But the most important thing is if someone has chronic gout, which they don't always tell you that, you can almost see the bone erosion. And we have a name for that. And the bone, and if it's chronic, we obviously see that in some of these bone joints.
So Martel's sign is the fancy $5 word that he's talking about.
Recommendations ko sa mga pasyenteng may gout. Number 1, itong cherry juice or cherry tart juice. Madaming studies na nagsasabi pagka uminom tayo ng cherry tart juice every day, it can lower the uric acid. Ano ba yung cherries? Ito'y antioxidant. Ito'y antioxidant with vitamin C, and based on studies, it can lower or decrease uric acid. So drink it, empty stomach, cherry juice, cherry tart juice, 8 ounce every day for 2 weeks. It will reduce your gout. And also studies showed that it can decrease flare-ups or gout attack. Alright? Number 2, ito isa sa mga paborito ko. Lagi ko itong ginagawa. Lemon ginger water. But with this one, i-add nyo ang baking soda. Ang baking soda, magkikreate yan ng alkaline. Magdi-decrease yung uric acid natin. Again, ginger. Ginger is a natural anti-inflammatory. So kasi ang gout, it's an inflammatory reaction. So pagka meron tayong monosodium urate or crystals na deposit sa joint natin, yung crystals niya magki-create ng inflammation. So it's actually not the uric acid, it's the reaction ng ating katawan. So nag-i-increase ang WBC. So magki-create siya ng inflammation, nagkakaroon ng swelling, redness, difficulty moving, severe pain. So napakasakit na ito. So ang number one natin gagawin, anti-inflammatory. Drink lemon ginger. Lemon, they also have studies about gout. If you increase vitamin C, wag yung I would rather drink or eat fruit or drink lemon ginger water para may vitamin C ka na, may anti-inflammatory ka na, and then the baking soda, powerful remedy. Babawasan ang ating gout. Again, hydration, because our kidneys, if i-filter yung uric acid natin, i-excrete yung uric acid, mababawasan ang increase ng uric acid sa katawan. So mababawasan ang uric acid sa katawan if you drink plenty of water, combination of lemon, ginger with baking soda. Number 1 para sa akin yan. Number 3, drinking apple cider vinegar. All right, that's anti-inflammatory, and it actually decreases uric acid too. As a physical therapist, I believe in Epsom salt with during the acute attack. It's gonna be painful, swelling, excruciating pain, of course, swelling, redness, and difficulty moving. So I like to use ice. All right, so ice with Epsom salt, again ginger, soak our foot or feet or foot, soak it for 20 minutes. Soak it for 20 minutes, and then you can do gentle active range of motion of your foot inside the water or underwater. You're gonna actively move your joints, and then that's a cold water. And then pagka chronic na siya and nag-reduce na yung inflammation, then you can start to do contrast bath. Kasi number 1, pagka acute stage, kailangan mabawasan yung swelling, mabawasan ng redness, at we also do gentle movements during the attack with cold Epsom salt and ginger and active range of motion. Now, pagka nabawasan yung inflammation, you can do contrast bath. Contrast bath, combination siya ng ice, all right, cold treatment and warm treatment. All right, so 10 minutes sa cold. All right, soak natin yung paa natin 10 minutes with Epsom salt and cold water, and then quickly go to the warm water, approximately 103, 104 degrees Fahrenheit. Soak it again for 10 minutes, again with Epsom salt and ginger, 10 minutes, and then back. You do this twice every day. So that's gonna help decrease the inflammation. Again, gout is a reaction. That's why it's super painful. It's because the immune system is fighting it. So we have to work on that inflammation, decrease that inflammation together with this all this powerful remedies. So, all right. So, kung madami kayo natutunan sa video na ito, please continue to share and subscribe. Subscribe sa Dr. Jun Reyes, PT DPT. All right. Take care.